So before we start today, please do review the disclaimer, which points out basically that what we're discussing today doesn't constitute investment advice. It's always best to do your own research or consult a professional for investment advice that's tailored to your circumstances. And just for information, this disclaimer is also available on our website. So that said, welcome back to the first Insights call for 2025. And as many of you know, this is designed just to be an opportunity for us to share ideas or thoughts that we have from an area of research that we think is interesting and we think should be of interest to our clients. Incidentally, we're always keen to hear any research suggestions that for topics that we haven't covered or things that you think we should revisit. So please do send in any suggestions. Today's discussion is about radiopharmaceuticals, which we hope will be something you've not had much contact with for reasons that will become clear as we go through. And I'm joined today by my co-PM, Gareth Blades. So radiopharmaceuticals, well, it's not a new market. It was first used successfully about 80 years ago, in fact, for treating leukemia and thyroid cancer, but it's really stayed on the fringes of medicine until quite recently. So the idea is to insert a radioactive fluid or tracer, as it's known, into the bloodstream, typically, which can be visualized using very sensitive detecting equipment, such as PET scanners, positron emission tomography, which also typically these days gets combined with something like a CT scanner to create a very effective, clear 3D image of soft tissues. And the tracer is really a type of sugar to which they attach a sort of radioactive isotope that shows up under the scanner. So the body reacts in a normal way to the sugar, but cancer cells in particular typically process sugars more quickly. So they tend to build up more of these radioactive isotopes, and that shows up as being brighter on the scan. The equipment for detecting and visualizing this process has improved really a lot over the last decade or so. And that's why demand for the products keeps increasing. So we think that's really interesting, but also it's not just the diagnosis side that's interesting, but also there are a lot of improvements that are happening in treatment or therapy. And these technologies are used for both. And in fact, the industry has come up with a very catchy term, combining therapy and diagnostics as theranostics, which we think you'll hear that term used a lot more in the coming years. So something to look out for. And it's really the therapy side where things are changing. So in innovation terms, we tend to get most interested or excited where we see, new developments happening in a number of different areas and combining to create a kind of new phase of growth for something. And here we obviously have the improvements in the scanning equipment that I mentioned, but the other really interesting side is the treatment area. And we've had a couple of particularly important treatments that have come to the market already. Two of them called Pluvicto and Lutathera from Novartis that are used for treating different cancers. And they've been very successful, and demand has really accelerated. But they're just the tip of the iceberg. There are numerous other treatments that are currently in development. And we're going to talk a little bit more about that now. But how do they work? Well, that's an interesting thing to dig into. And helpfully, we have with Gareth a PhD biochemist on hand to explain. So over to you, Gareth.
Thanks very much. So the radiopharmaceuticals are something called an antibody drug conjugate. So rather than kind of a traditional radiotherapy where beams of radiation are fired externally to the patient towards the tumor site on the inside, this is delivering a therapeutic directly and specifically to the tumor cells. And so the basic structure of the